During pregnancy, an ultrasound scan is a window into your baby's world. It allows doctors to see how your baby is growing and developing. Sometimes, these scans reveal something unexpected, a possible difference in the baby's structure, like the heart, brain, or kidneys. When an ultrasound shows a potential structural abnormality in a baby, it naturally brings up many questions and concerns for expectant parents. It's important to remember that this finding is a starting point for understanding, not a final answer. The very next question is simple: what is causing it? Often, the key to understanding lies within the baby's genetic blueprint, the chromosomes. In this guide, I will walk you through the main diagnostic tests doctors use to examine a baby's chromosomes. We'll explore what these tests can find, what they can't, and how fast the answers come back. Our goal is to provide information in a way that is calm, clear, and step-by-step, empowering you to have more informed conversations with your healthcare team. Please note, this video is for educational purposes and should not replace advice from your medical provider. First, how do we get the genetic material needed for testing? To analyze a baby's chromosomes, we need a sample of their DNA. This is obtained through one of two main diagnostic procedures. The choice depends on how far along you are in your pregnancy and other medical factors. The first option is chorionic villus sampling, or CVS. This is usually performed between 11 and 14 weeks of pregnancy. The procedure involves taking a tiny sample of the chorionic villi, which are small, finger-like projections on the placenta. Since the placenta develops from the same fertilized egg as the baby, its cells contain the same genetic information. A specialist uses a thin needle, guided continuously by ultrasound, to collect the sample, either through the abdomen or the cervix. You might feel some cramping, similar to a period pain, during and shortly after. The main advantage of CVS is that it can be done earlier in the pregnancy, providing answers sooner. The second option is amniocentesis. This test is typically done after 15 weeks of pregnancy. During an amniocentesis, a specialist uses a very fine needle to draw a small amount of amniotic fluid from the sac surrounding the baby. This fluid contains fetal cells that have been shed, which can be used for genetic analysis. Like CVS, the entire procedure is monitored in real time with an ultrasound to ensure the needle is placed safely. Many women describe the feeling as a brief sting followed by a sense of pressure. Both CVS and amniocentesis are considered safe and are performed by highly trained specialists. However, they do carry a small risk of miscarriage, which has significantly decreased over the years with the use of ultrasound guidance. Your doctor or a genetic counselor will discuss these risks in detail, helping you weigh the benefits and choose which procedure, if any, is right for you and your family. Once a sample is collected, the laboratory work begins. Let's start with the rapid tests. The first is quantitative fluorescent PCR, or QF-PCR. Think of this as the quick check. It's designed to rapidly count the number of specific chromosomes. It focuses on the most common chromosomal conditions, known as aneuploidies, which means having an unusual number of chromosomes. This includes Down syndrome, which is caused by an extra copy of chromosome 21, also called trisomy 21. QF-PCR also screens for trisomy 18, known as Edwards syndrome, and trisomy 13, known as Patau syndrome. Additionally, it checks for aneuploidies of the sex chromosomes, X and Y, such as Turner syndrome or Klinefelter syndrome. The major advantage of QF-PCR is its speed. Results are typically available in about 1 to 3 days. This quick turnaround can significantly reduce the period of uncertainty. However, it is a targeted test. It is fast, but it does not scan every chromosome or look for smaller genetic changes. Another rapid targeted test is fluorescence in situ hybridization, or FISH. You can imagine FISH as a targeted flashlight. It uses fluorescent probes that act like beacons, lighting up specific parts of a chromosome. If a doctor has a strong suspicion about a particular condition linked to a known chromosome region, for example, a specific microdeletion syndrome suggested by ultrasound findings, FISH can be used to check that exact spot. Like QF-PCR, results are fast, often ready in 1 to 3 days. It's excellent for getting a quick answer to a very specific question, but it is not a genome-wide screen and will only provide information about the regions it was designed to target. For a more comprehensive view, we turn to chromosomal microarray analysis, sometimes called CMA. A test like CNV-Sure microarray gives a high-resolution map of all 23 pairs of chromosomes. While rapid tests count whole chromosomes, microarray goes much deeper. It surveys all chromosomes at a very detailed level, looking for tiny missing or extra pieces of genetic material. These are called copy number variants, or CNVs. A missing piece is a deletion, and an extra piece is a duplication. These CNVs can be too small to be seen by other methods, but they can have a significant impact on a baby's health and development. Microarray is particularly useful when an ultrasound shows a specific structural abnormality in an organ like the heart or brain, but the rapid QF-PCR test comes back normal. It can uncover the underlying genetic cause that the quick tests can miss. Because this analysis is so detailed, the results take longer, typically arriving in about 5 to 10 days. It provides a wealth of information, but it cannot detect certain balanced structural changes, which we'll discuss next. Finally, there is the karyotype. This is the classic big picture test and has been the gold standard for chromosome analysis for decades. A karyotype involves growing fetal cells in the lab and then taking a microscopic photograph of the chromosomes from a single cell during division when they are most visible. The chromosomes are then digitally arranged in pairs from largest to smallest, creating a map. This allows cytogeneticists to visually inspect the chromosomes to find large-scale issues, like a whole extra or missing chromosome, similar to QF-PCR. Crucially, a karyotype is the best test to detect balanced structural rearrangements. This is where a piece of one chromosome has broken off and reattached to another, a translocation, or a segment of a chromosome has been flipped upside down, an inversion. In these balanced cases, no genetic material is lost or gained, so a microarray wouldn't detect them. However, they can still have implications for the baby and for future pregnancies. Because it involves cell culture, a karyotype is the slowest test. Results often take 14 to 21 days. It sees the big structural changes, but not the tiny CNVs that a microarray can find. So, how do these tests fit together? Healthcare teams often use a strategic approach. Many teams start with QF-PCR for speed. If a common trisomy is found, this provides a fast, definitive diagnosis. If the QF-PCR is normal but there are significant ultrasound findings, the same sample is often reflexed to a microarray for a more detailed investigation. This combination provides both speed and depth. FISH is used when there is a strong, specific suspicion for a condition that it can quickly confirm or rule out. A full karyotype might be added if there is a family history of a rearrangement, or if the pattern of ultrasound findings suggests a translocation might be involved. This tiered approach ensures that parents get the most relevant information as efficiently as possible, balancing the need for quick answers with the need for a thorough investigation. Force. VO. Receiving the results of any of these tests is a significant moment. The results will be delivered and explained by your doctor or a genetic counselor. They will help you understand what the findings mean for your baby's health and for your pregnancy. A normal result can provide immense reassurance. If a chromosomal condition is identified, the counseling session is crucial. Your team will provide information about the condition, discuss the range of possible outcomes, and connect you with support networks and specialists. It's also important to remember the limits of testing. No test finds everything. Some genetic conditions are caused by changes within a single gene, which these chromosome tests are not designed to detect. Furthermore, some health issues are not genetic at all. Another complexity is mosaicism. This is when a baby has 2 or more different cell lines in their body, some with the chromosomal change and some without. This can be tricky to diagnose and can make it harder to predict outcomes. Your genetics team is the best resource for navigating these complexities. The journey of prenatal diagnosis can be challenging, but you are not alone. Clear information and compassionate support are key to making the decisions that are right for your family.